Hi, my name is Tika Della Sala, and you may know me as the girl who falls asleep just about everywhere. And you may be wondering, how do I not get in trouble? Well, today I'm going to tell you I have postural orthostatic tachycardia syndrome, otherwise known as POTS. Today we're going to delve into what POTS is and how it affects day-to-day life. Postural orthostatic tachycardia syndrome, otherwise known as POTS, is a condition where the heart rate increases excessively when a person stands up from a seated or lying position, often causing symptoms like dizziness and lightheadedness. It is a type of autonomic nervous system disorder, meaning the body's automatic functions like regulating heart rate are not working correctly. So what are some of these symptoms? Common symptoms include dizziness, lightheadedness, fainting or near fainting, fatigue, palpitations, nausea, instability, and breathing issues. Some other symptoms included but are not limited to fatigue, brain fog, headaches, gastrointestinal issues, sweating, shakiness, muscle pain and aches, sleep disturbances, exercise intolerance, and vision changes. So let's talk about it. With fatigue, you will feel excessive tiredness that can be debilitating. With brain fog, you'll feel difficulty concentrating, remembering, or even thinking clearly. With headaches, you'll often have pain in the head, which is often associated with POTS. With gastrointestinal issues, you may have nausea, vomiting, bloating, constipation, or diarrhea. With sweating, you will have excessive perspiration, otherwise known as sweating. In regards to shakiness, you will feel shaky or unsteady. And in regards to muscle pain and aches, you'll feel chronic aches and pains in the muscles, and sometimes even in the joints. With sleep disturbances, you may have difficulty falling asleep, staying asleep, or experiencing restless sleep. As for me, I have insomnia and hyperinsomnia, which means that during the day, I fall asleep constantly, and during the night, I can barely get to sleep. With exercise intolerance, you can have difficulty performing physical activities due to fatigue and other symptoms. And with the vision changes, you might experience blurred vision, tunnel vision, or excessive glare. Some cases even have double vision, which has happened to me a couple of times. So how does this affect day-to-day life? POTS significantly impacts daily life due to its symptoms like dizziness, lightheadedness, fatigue, and exercise intolerance. This can affect different activities such as school, work, and social events. Some individuals may experience fainting, furthering the inability to participate in daily routines. POTS can also lead to concentration issues and cognitive dysfunction. I personally used to experience fainting spells before medication, and now I'm practically forced into sleep or blackouts throughout the day. Fatigue definitely majorly impacts me in my life. So what can we do about this? Well, besides raising awareness, there is treatment. POTS has no cure, so it's more about managing symptoms and improving quality of life. Treatment typically involves lifestyle modifications, including hydration, diet, exercise, and potentially medications. I personally take a beta blocker, a vasoconstrictor, and a corticosteroid. Since people with POTS require more sodium as they have lower blood volume, I also take salt tablets. Salt tablets help with fainting spells and lightheadedness. You can also do IV infusions with your cardiologist or local specialized doctor. Unfortunately, with POTS, there are other illnesses often involved. As well as having POTS, a lot of patients, including me, also have Ehlers-Danlos syndrome, otherwise known as EDS. This disease is characterized by joint hypermobility and connective tissue issues. In other instances, it can also be vascular. 80% of people with EDS have POTS, and 31% of people with POTS have EDS. Both of these illnesses disimprove quality of life and have no cure. So how do you get diagnosed? To get diagnosed with POTS, you can go to a primary care physician, a cardiologist, a neurologist, or an autonomic specialist. Here they can do a variety of tests, including a physical exam, a detailed medical history examination, heart rate and blood pressure monitoring while standing, and a tilt table test. Personally, I went to a cardiologist where he did a physical exam and looked at my medical history and other variety of diagnoses. It was actually really interesting, as he said I had POTS from symptoms up to a baby into childhood and adulthood. He also confirmed my diagnosis of EDS just by the way I was holding my pen when I was filling in the symptoms checklist. I go to Natraj Bahal. He is a great cardiologist I would recommend. On another note, POTS can also cause mental disorders such as depression and anxiety, which can be another factor in your diagnosis. So what causes flare-ups and what happens to your body during them? POTS flare-ups, or where your symptoms worsen, are often triggered by factors that impact blood volume, autonomic nervous system function, or stress. Common culprits include dehydration, prolonged standing, heat, stress, and certain foods or medications. Infections, illness, and even menstruation can also exacerbate POTS symptoms. During a POTS flare-up, individuals experience an increase in their usual symptoms, often involving a rapid heart rate increase upon standing, which is known as orthostatic tachycardia, and a worsening of orthostatic intolerance, which can manifest as dizziness, lightheadedness, or even fainting. Other symptoms like fatigue, brain fog, nausea, and digestive issues may also intensify. People with POTS tend to pool a larger amount of blood in vessels below their heart when they stand. Their body responds by releasing more norepinephrine or epinephrine to try to cause more squeezing of their blood vessels. For several reasons, their blood vessels don't respond normally to these hormones, which causes the symptoms. On a personal note, I got diagnosed this year with POTS, and let me tell you, it has not been easy. I feel malaise almost all the time, which is the feeling of being unwell. I have missed school and had to entirely change my lifestyle. I want to bring awareness to this disability, as it isn't just something most people talk about. People with POTS can be deemed as just lazy, which is definitely something I've experienced. People think I sleep during some school hours just because, but truly my body just physically shuts down. With fainting spells, people may just appear to be falling asleep, which is why it's important to let other people know what's going on in your life. I'm lucky that my school has been so supportive and has allowed me accommodations such as being able to eat during class, sleep during class, or rest in clinic when necessary. I have a student plan already due to other reasons I won't get into, but my school is willing to add on to this with the help of my dietitian and cardiologist. I am truly grateful to my teachers and family throughout this whole process. It's a hard journey. Before being diagnosed with POTS by my cardiologist, I went to a variety of different doctors and did a lot of different tests. I went to, and still go to, psychiatry and rheumatology, and even did a sleep study. When my sleep study came up negative for narcolepsy, we went to cardiology, where I was eventually diagnosed. POTS is a great imitator, which is why so many people go through life not knowing what's truly going on. That's why it's important to reach out and raise awareness to this invisible but chronic disability. POTS is a complex disability that affects 1 to 3 million people in the United States alone. For more information, talk to your doctor, a POTS patient, and just out to know me a support group or online and textual resources. Thank you for listening to the podcast of Tika Della Sala.